We have made, as Bill pointed out earlier, amazing progress on child mortality, that is, the deaths of children under the age of 5 years old. But in that first 30 days of life, that newborn period, we've made very little progress at all. There are still 4 million babies that die in that first 30 days. Most of them are in poor countries, and 3/4 of those babies die in the very first week of life. Many of these deaths happen in rural, remote parts of Africa. And what we hear from the parents when you go out and visit them is they don't even name their babies, because they tell us it's just a little bit less heartbreaking to bury a baby that has no name. In addition to these newborn deaths, there are 500,000 mothers that die every single year in childbirth. Now, that alone is a tragedy. But when you think of what happens to that family and how it destabilizes the family and the father and the other children in that newborn, it's absolutely horrific. Without a mother, the family often can fall apart. So I'd like to introduce tonight Leah Kebede. She's a fashion model. You might have heard of her from Ethiopia. In 2005, she was named WHO's Global Ambassador for Maternal, Newborn, and Child Health. And she's seen the real challenges and progress in Ethiopia on these newborn and maternal issues.
It's 3 a.m. in a remote village in Ethiopia. A woman named Kumi is in labor. The nearest clinic is hours away, and her only choice is to deliver the baby on the dirt floor. Even though I grew up in Ethiopia, and I knew giving birth here was dangerous, nothing prepared me for seeing it firsthand. It's literally pitch black in there. The thing is, every time a woman is delivering in a place like this, her chances of survival, I don't even know how you survive. Not far from Kumi, a loving father named Alamu Amelo reads to his 7-year-old daughter, Amarech. Just 7 months ago, his wife hemorrhaged to death during childbirth. My wife was the love of my life, he said. Alamu now has to be both father and mother to his 2 little girls. He says he doesn't know what he's going to do. When a woman dies in childbirth, the whole family, the whole community feels the effect. And then there are the newborns. 1 in 32 babies in the developing world dies during the first month of life. Dr. Mulu Alam Gassasa is a neonatologist in my hometown, Addis Ababa. She works 7 days a week and sees thousands of babies a year. While giving a tour of the facility, she had to stop to resuscitate a baby girl, just 14 hours old. She was struggling to breathe. When asked the chances of the baby surviving, she held up her hand and said, 0.
When you lose one, you cry. In spite of everything we are doing, it's not easy just to lose a life.
But there are glimmers of hope. With support from US funding, the Ethiopian government and global partners have recently launched new programs to provide pregnant women with prenatal care and clean and safe delivery. Because of those efforts, a trained birth attendant arrived in time to help Kumi deliver a healthy baby girl. She named her Idile, which means lucky day. If these efforts can grow, my hope is that one day soon, a healthy childbirth in my country will no longer be considered a stroke of luck.
Leah is here with us tonight. Leah, will you stand and be recognized? The video you've just seen shows why there's been very little progress on these newborn births. Conditions for giving birth are very, very tough in these rural areas, but we do have a chance to turn things around. And it starts with health workers. We have to have people, that staff these very remote health clinics and who can visit expecting mothers at home and give them the basic medical supplies that they need. And countries like Ethiopia are starting to make this happen. They're seeing the benefits. I visited Ethiopia twice in the last 12 months, and I was completely blown away to see these 30,000 health extension workers that they have trained and these 15,000 remote rural health clinics where a woman can come in and deliver her baby, or the rural health worker can go out and visit the woman in her home. These new workers are just starting to make a difference in Ethiopia. Most newborns die of a few basic conditions. They die from severe infections. Often a woman will wash her baby right after it's born, and that can introduce an abrasion and then an infection through the skin. Many of these babies die of hypothermia. And we know what one of the main causes is of mothers dying during childbirth, and that's hemorrhaging. So these health workers who work in these remote places, they don't have to know everything about pregnancy. They just have to know the key things that can make a really, really big difference in tackling this. And they have to be able to treat those conditions. Now, some of the solutions are actually really very simple, and they're cultural. And that is teaching a woman not to wash her baby when it's first born, keep the vernix on the baby, and to wrap the baby up and keep the baby warm. That goes a very long way in terms of preventing hypothermia. A mother who breastfeeds her baby right away gives the baby's immune system a chance to begin to develop and to work. There are also 2 very inexpensive drugs that can prevent postpartum bleeding for a mother so that she doesn't hemorrhage during childbirth. One of them they get when they come into a remote health clinic, or another one we're looking at eventually being able to deliver to the woman so she could take it home with herself. And if there's not someone to attend to the birth, she could give it to her herself, and it's less than $1. So Bill and I are optimists. But sometimes the word impatient, quite frankly, feels too polite to me. We're optimistic because the world knows what the main causes are of these maternal and newborn deaths. And we've developed low-cost solutions to these things. But the solutions won't solve anything if we don't deliver them to the mothers who need them. Every human life is precious, and a child's death is absolutely tragic. So whenever we see an urgent need and we're not meeting it, it can be really, really frustrating for us. But it can also be deeply motivating.